Welcome to the third section of Hazardous Drugs and Your Safety, Balancing Cutting-Edge Medicine and Team Welfare. In the next 10 minutes, you'll learn about the role of personal protection equipment. You'll learn about the 4 different types of PPE, and you'll learn what personal protection equipment is critical for veterinary team members who are working with hazardous drugs. First, a quick recap. The CDC notes that veterinary team members and veterinarians are at risk of hazardous drug exposure. Potential risks of hazardous drug exposure include acute and chronic health effects, everything from skin rashes to hair loss, to adverse reproductive outcomes, and possibly leukemia and other cancers. Keeping these serious risks in mind, the importance of attention to appropriate safety precautions in handling hazardous drug preparations in the clinic setting cannot be overemphasized. The veterinarian is legally and ethically obligated to educate staff regarding safe handling of chemotherapeutic drugs. Veterinary medicine has evolved. It is so exciting that we are better able to combat what used to be hopeless diagnoses. Clinic safety protocols must advance alongside treatment options to keep the veterinary team safe. Do you know where the written hazardous drug protocols are located in your practice? Written protocols keep teams safe. While hazardous drug exposure is always a constant threat when chemotherapeutic agents are used, proper procedures and policies can minimize the risk. The role of PPE. Personal protection equipment plays a key role in keeping veterinary team members safe. The 4 types of PPE are eye and face protection, hand protection, body protection, and respiratory protection. Some of the basic elements of personal protective equipment. Examples of PPE include respirators, gloves, aprons, fall protection, and full body suits, as well as head, eye, and foot protection. Using PPE is only one element in a complete hazard control program that would use a variety of strategies to maintain a safe and healthy environment. PPE does not reduce the hazard itself, nor does it guarantee safety. What is the role of PPE? PPE is equipment worn by a worker to minimize exposure to specific hazards. Let's start with dressing for safety. Scrubs or low-lint clothing should be worn by all personnel working in a controlled work area and/or with hazardous drugs. Pants should fully cover the legs. It's gown time. To decrease particulate levels in the preparation area and to decrease the risk of direct skin contact with hazardous drugs, you must wear a gown meeting these standards. Disposable and non-linting, impermeable, long sleeves, and closed on the front. Tight-fitting cuffs, tied around the waist. Chemotherapy gowns must be worn for all activities that may result in the worker's direct exposure to hazardous drugs. Do routine surgical masks prevent aerosol exposure? There is no protection against aerosol risk with a routine standard mask. Surgical masks do not provide respiratory protection against hazardous drug aerosols. However, they do protect the clean room environment from possible contamination by personnel. So how do you protect against an aerosol risk? By using a proper respirator. A respirator is a personal protective device worn on the face that covers at least the nose and the mouth. It is used to reduce the wearer's risk of inhaling hazardous airborne particles, gases, and/or vapors. Are there disposable respirators? An N95 respirator is one type of disposable particulate respirator. These respirators only protect against inhalation of particles, not gases or vapors. Should you use examination gloves for handling chemotherapy drugs? No. Regular exam gloves are not recommended for use as standard protocol for handling chemotherapeutic agents. Chemotherapy gloves worn when mixing hazardous drugs in the biological safety cabinet must be sterile and be long enough to cover the cuff of the chemotherapy gown. If powder-free gloves are not available, powdered gloves must be wiped with a clean, low-lint wipe pre-moistened with sterile 70% alcohol prior to entering the clean room. Alcohol must not be sprayed onto gloves to remove powder. Gloves approved for use with hazardous drugs must be tested with 9 chemotherapy drugs as required in the American Society for Testing and Material. 1 or 2 pairs of gloves. 2 pairs of disposable chemotherapy gloves must be worn at all times by all personnel working with chemotherapy. Both pairs of disposable chemotherapy gloves worn when handling hazardous drugs must be changed every 30 minutes unless otherwise recommended by the manufacturer's documentation, or immediately if a tear, puncture, or contamination is known or suspected. Aurelia gloves are one great example of chemotherapy gloves. The manufacturing standards for Aurelia examination gloves are established by the American Society of Testing and Materials after the Food and Drug Administration approved the manufacturing site. The standard testing procedures adhere to regulations for water thickness, tensile strength, and dimension. Aurelia gloves go beyond the standard to premium quality in all categories. Is there anything we're missing? Eye protection. Don't forget to protect your peepers. Critical PPE for veterinary staff include eye and face, hand protection, body protection, and respiratory protection. The correct eyewear, the correct type and numbers of gloves, the correct gown with shoe and hair coverings, and the correct mask or respirator. Join us for our next presentation where we will talk about closed system drug transfer devices, how they can help and when to use them. These are one of the best little inventions ever. Are you using them in your practice? Stay safe while you're out there saving lives. Thanks for joining us today.